Greetings. I'm Dr. Lipi Roy, and welcome to my new series, Health, Hockey, and Leadership. Today's conversation is so cool. I'm talking to the team orthopedist for the New Jersey Devils, Dr. Guillem Gonzalez-Lomas. Here's a guy who's an orthopedic surgeon who loves hockey. He's also a fellow Torontonian, as I am, and he has such a unique perspective at vantage point in terms of what he does, who he takes care of. We were going to be talking about the most common injuries that he sees, talking about concussions, talking about the pressure of getting players back on the ice, how he handles that, what hockey means to him, what leadership means to him, and what he does for self-care and fun. You are not going to want to miss it. Let's get started.
Good.
Greetings, everyone. This is Dr. Lipi Roy, and welcome to Health, Hockey, and Leadership. I am here with Dr. Guillem Gonzalez-Lomas, and we are going to be talking about health, hockey, and leadership. So, my very first question to you, my friend, is tell us where you're from. I know we're both Torontonians, and your journey to becoming the New Jersey Devils, part of the New Jersey Devils medical staff. And what was that always your goal? Pun intended.
Yeah, well, thank you so much, Lippy, for having me on. It's really an honor and just a topic that I love thinking about, talking about, and so really excited to share thoughts with you. But as you mentioned, I am from Toronto originally, so my background, my parents are originally from Spain, and when they moved to Canada, which was in their early 20s, I think both of them, but my dad especially, like really immersed himself in Canadian culture. Like he was like, I'm gonna do everything that like is is supposedly Canadian. So part of that was getting really into hockey, and as you know, and it's funny, and we could talk about this. I think things have changed a little bit. I have friends with younger children now, who just surprisingly, have not gotten them into hockey. I think there's been more of a sort of an insurgence of soccer interest as the Canadian soccer team has started to get a lot better. But very
Yeah.
interesting to me that's changed a bit. But certainly when I was a kid, you had to at least try it. Everybody. Initially boys, but eventually boys and girls, really got exposed to it. And so I started skating when I was about 4 and then sort of progressed through initially kind of a local house league and then eventually onto at the time the league was called the MTHL, the Metropolitan Toronto Hockey League, and got to play up to a double A level out of triple A. So pretty much knew I was never going to play professionally, but yeah, still played a little bit in college. I went down to the U.S. for college, to Yale, and then I actually just kept on playing here and there, even in medical school. I went to medical school in New York, at Columbia, and we had a little men's league that we played in here, and it's really continued to this day. So I've had kind of periods of time where I have not played hockey, but pretty much not more than a few years. And even when I did my fellowship in Los Angeles, honestly, that's probably the most hockey I played. I was playing like 2 or 3 days a week there because there was so much ice time available.
Well, what I love, what you and I really have in common is that, yeah, we love hockey. We're not professional hockey players, but we love hockey. We also obviously love health and medicine because that's what you and I both do professionally. So you did medical school, orthopedic surgery, and then you did a fellowship in sports medicine, right?
Correct. Yes. So, in medical school, and I think maybe you felt the same thing, but for me, the driving force to get into medicine was, and now it's interesting. I'm on the other side side reading resident and fellowship applicant personal statements, and they all talk about either growing up fixing cars or building tables or having had to deal with an injury.
Yeah.
And that was what happened to me. Not actually a hockey injury, but although I had some of those, but some other injuries throughout college. And so for me, very early on, it became clear that orthopedics was what I was going to do, and really the focus actually was always on sports medicine.
You have such a unique vantage point, Guillem, because you're obviously still you continue to be a hockey fan, but you have like an acute knowledge of the players and their health status. Can you describe like some of the most common injuries that you see and then the interventions that you use?
Sure. So, talking about hockey specifically, it is the important thing to know about it is it's a contact sport, and it's also the fastest sport, not motorized, that's out there. So, other than Formula One or I guess cycling, but in terms of a sport where you don't use another implement, where you use your own power, it really gets these guys going at very high speeds, into the mid 20 mile an hour range.
Yeah.
And that introduces a whole host of risks and management issues, because, if we just go back to physics, there, momentum and, when you talk about, energy, the speed and mass, figure prominently in that. So, for, the like anything, the most common injuries are typically the mildest ones. So we see commonly hit by pucks, right? And that's the other part of hockey that's very unique. They're not just skating at a really high rate; they're facing 100 mile an hour shots, and then there's a lot of other sharp implements.
Yeah.
Skates. The sticks are pretty hard, and all this is occurring incredibly quickly. It's funny. I have a kind of a men's pickup game that I play on Mondays, and a lot of times the Devils will play on Tuesdays.
Yeah.
So in my mind, I am able to compare the speed that I'm going at on Monday with the speed on of the game on Tuesday,
Yeah.
and it's almost hard to comprehend. Most commonly, it's usually some sort of contusion or hit by, puck or stick.
Right.
The second thing would be muscle injuries, right? Muscle
Right.
strains, just like in any explosive sport. Most of the time, they're fairly mild. Sometimes they're a little bit more extensive, and players need time off. And then we start to get into ligament injuries. And again, more commonly, we see the um, lesser involved ligament injuries, things like, low-grade MCL, medial collateral ligament
Yeah.
sprains, shoulder sprains, wrist, elbow, that kind of thing. But occasionally we do see some major injuries to ligaments, and that would include shoulder dislocations, which are actually fairly common,
Yeah.
shoulder separations where the AC joint gets
Yeah.
injured, so the joint at the end of the clavicle of the collarbone,
Yeah.
and then we occasionally see some ligament injuries in the knee. We said MCL injuries.
Yeah.
You can have high grade injuries or even injuries to the ACL in the middle of the knee.
It sounds like what you're describing is like what we usually say like musculoskeletal types of injuries, right? Like sprains, strains, but even like fractures. I don't know how common fractures are.
Fractures absolutely occur, and again, it starts with the ballistic element of the sport, right? So
Yeah.
being hit by a puck,
Yeah.
by sticks, even just the act of getting checked can lead to that. And sometimes, like occurs in other sports that are even non-contact. I mean, you can get these non-contact injuries and fractures. So oftentimes we'll see that with ankles, for example. So the skate gets caught in a rut or gets pinned against the boards, the
Yeah.
player turns and they can injure their ankle
Um,
and fracture it.
Guillem, you talked about like the speed for anyone, my viewers watching. If you watch a hockey game on TV, yeah, it looks fast, but go to an actual live game and you get just an appreciation for just how fast it is. And those body checks that you were describing, Guillem, I mean, wow, yeah, everything is moving fast. The puck's moving fast, the players are moving fast. So yeah, I couldn't agree more. Um, Guillem, you probably know better than anyone that head injuries, unfortunately, are not uncommon in hockey. I'm assuming, but can you confirm, like, do the New Jersey Devils like have a concussion protocol?
Yeah, absolutely. And that's a great point. And you're right. It's funny. It's my orthopedic bias that sometimes bleeds into my answer. So certainly we have injuries that are not musculoskeletal and first and foremost would be concussions. And that's an unfortunate aspect of every collision sport. We've
Yeah,
seen football have to deal with that.
yeah,
And hockey really has gotten a lot better over the last few years, even since I've been covering the Devils, which is about 4 years now. I've seen really good progress in how to manage it. So, actually, the concussion management starts. First of all, it's all about education. So we know that athletes can get concussed even in practice, right? They can get
right.
concussed even outside practice. I mean, just in their life. So having the athletes understand that this is an important injury and that if it's not witnessed, it's something that needs to be reported is critical. The training staff, they're all incredible. They've done a ton of work on understanding how to at least identify the risk of a concussion, right? Like something that might be a concussion that then needs to be evaluated. All of our athletes do baseline testing.
Okay.
So there's already a baseline that we can compare to, especially with things like, for example, the SCAT, where we can look at what their current score is compared to a baseline score where presumably they didn't have a concussion. But then at the league level, they're also spotters. So obviously this only occurs during games. But if a player gets hit and there are certain criteria that the league, that the spotters, and this will be kind of in Toronto, where they're looking at all the games. So they're checking for any hit or any kind of player behavior that
Right.
might be suspicious for a concussion. So then they inform the team that that's either so in some cases it would be mandatory, where the player would have to leave and have a full concussion workup done.
Yeah.
And in other cases, they do leave it up to the team to assess, kind of quickly, do a triage. So at every level, I think player education, team, medical staff, and league level, we've really come a long way in terms of first identifying, evaluating, and then managing these concussions, these injuries.
That's fantastic. Thank you for that really good comprehensive response. As you know better than anyone, like players want to play. And for some players, an injury may lead to maybe say a 1 week absence or missing, say, 3 games, which for them might be too much, let alone 6 to 12 months or more, like Colorado Avalanche, their captain Gabriel Landeskog. How do you manage as a team orthopedist for the New Jersey Devils? How do you manage, like, say, the frustration or anger, pain, sadness, or whatever emotions that that player is going through, that the player may feel, including the pressure that he or, say, the coach or the executives, whoever, might place on you? Like, how do you navigate that?
Yeah, that's a great question, and I really think it's again, I think just to emphasize, it really is all about communication and having good open lines of communication. And the second piece is trust. In any relationship, trust is very difficult to gain, but very easy to lose. And ultimately, a team, I mean, this is like a little army battalion, right? I mean, they go out and they do battle every single day, physical battle. I mean, they're putting their lives on the line.
Yeah,
We are just talking about pucks. I mean, these guys will throw themselves in front of 100-mile-an-hour shots, right? So it is all about trust. Like you
yeah,
don't do that unless you feel like the guy next to you is going to do the same thing. And that really applies to the staff as well. And so medical staff, which includes the athletic trainers, the physical therapists, certainly the physicians. So the most important thing that I think that you can do is initially establish that trust.
yeah,
And if you have that, uh, players will listen to you.
yeah,
And there are obviously times where you don't have good news for them,
yeah,
but they will respect what you're saying and they will feel like you have their best management. They've got to make very difficult decisions. Uh, and I absolutely think that just as a on the physician side of things, it really comes down to the same way that you interact with the players with good communication. You do that with management as well. And I think if you do that, you rarely go wrong. But truly having the players' health and their safety uh, first and foremost in mind. I mean, because truly the like management has that as well.
Yeah,
They have to make personnel decisions, but ultimately and I'm fortunate that I happen, I'm on a team where management really does care about the players.
yeah.
Um, and so if you just stick to your guns in terms of that, it's the best you can do to try to like help navigate players through difficult situations in terms of injury and time lost.
There are two things that you said that really resonated with me, especially as a physician who takes care of people with addiction. One is communication is key and trust. Trust takes a while to gain, but it's really easy to lose. So I love that you said that, and that absolutely applies, it sounds like, with your players, and particularly when you're you have to give kind of bad news or suboptimal news. So that's a great segue into what I really want to ask next, which is sports, particularly at the elite level, can be as much psychological as it is physical. How do you think mental health affects performance, injury, and recovery of the athletes?
I mean, it's everything, right? Like our
Yeah,
our our bodies without our brains don't do too much.
nope.
So we need to have the CPU here, working and in good working order in order to optimize our performance. I think it's critical. I think we're understanding that more and more. And you bring up a great point. A lot of athletes, I mean, this is obviously beyond hockey. I mean, but just in general with athletes, these are typically young men and women. Many times they've had very unique backgrounds, right? So you and I probably followed like a pretty straightforward educational, progression. Maybe we took a year off here and there, but we sort of did like a very kind of standardized progression. A
Linear
lot of that
path.
included, yeah, exactly. A lot of that included kind of this sort of standardized socialization, right? I mean, we were in elementary school and then in high school and
Yep.
then in college where we were finally sort of living on our own, maybe if we weren't living at home, and then medical school, et cetera. So a lot of these athletes since they were in maybe early high school, they've had a completely different path. So in hockey, they may have played juniors, they may have been with a host family, not even with their own family,
Right.
living thousands of miles from their hometown. Probably didn't go to college. Some of them did. If they did, many of them probably didn't finish college because they didn't want to burn some potential years of professional play. So they're you have to remember that the experiences of these players are not always the experiences of a lot of the maybe our colleagues, people we interact with every day. And so as such, I think it's important to again, offer education, and there are different ways that we can do that. More and more, the teams have support for that, for players. A lot of times, players may not even know that mental health help is available. And so identifying where there's a problem, educating the player, and then offering them assistance and resources, that's huge. And so I think we're getting better at that. I mean, that was something that just did not exist in professional sports,
Oh, right.
even a
Exactly.
few decades ago, right? And
It sounds
now,
like, Jim, a
we
lot
have
of teams
we have
have
more.
like team psychologists, like New Jersey Devils, similar, like mental health and all those services.
Yeah, yeah. Exactly. So we have team psychologists. So and listen, hockey culture is very interesting. It's an honor system. A
Yeah.
lot of times it's one of those stiff upper lip cultures. Like you don't, guys get hit by pucks, don't show pain. Like get out there, finish your shift, get out there for the next shift.
Huh?
And similarly with mental struggles, a lot of times the culture is still there. Like just keep it to yourself. But what
Yeah.
we're trying to do is make players understand that listen, it could be completely anonymous, it can be completely private and completely specific to them. No one needs to know, but if they need resources, they're available for them. And exactly, so we have a great psychology, like a sports psychology team with the Devils that helps out.
I'm so glad you also talked about like yeah, part of the NHL culture, the players that they're there to support each other, and if they're having these mental health struggles, issues, they don't want to really necessarily talk about it, but that's very consistent with the public in general, where mental health issues are still really stigmatized and people don't want to talk about it. But I appreciate you sharing that. So speaking of hockey, Guillem, as you know, the title of the show is Health, Hockey, and Leadership. In a couple of lines, just tell me what hockey and specifically the National Hockey League mean to you.
Yeah, that's a great question. I mean, for me, it's a very personal meaning. It's funny. It's sort of part of my identity, even without having played at the professional level. But it's one of my favorite things to do, right? One of my favorite hobbies, and it's funny. Before we got on this call, I was just thinking about, how, yeah, it's actually been one of the few constants in my life. Like no matter where I was, I've kind of found a way to incorporate it. And I will tell you, my personal experience with it is it brings together people that are really, in general, pretty good people. I mean, I think, like other team sports, the team aspect of it attracts people that like being part of a team. The other thing that's now that I'm appreciating as I get older is it's one of the few team sports that you can actually do as you get older.
Yeah,
So other sports, soccer, I think basketball, maybe you can get away with it. But, because it's non-impact, you could be in your 60s and be extremely competitive and have and be playing with, kids in their 20s and it be a very reasonable fit. So it is one of those kind of glue sports that for me has been just a source of tremendous camaraderie and enjoyment throughout my life. I think the NHL is like the ultimate um, you know, permutation of that, right? It's the ultimate representation of that. And I think what I feel like I'm seeing more of is, there was a time, and we just mentioned how, it was kind of this like original Canadian culture thing, but I think we're seeing that it's really expanding culturally, and we see players that look differently than the typical player 30 years ago. We're starting to see a little bit more diversity in the league, which I think is a amazing. We're seeing it both geographically, even ethnically,
yeah,
and so. Like that's the way it's got to go, right? Because I think it's a phenomenal sport. I mean, I think one day it might be the only place where we can actually see real ice,
yeah,
a hockey rink, because there won't be any
yeah.
outside. But
Uh,
I hope that, we make it through even the global warming apocalypse and we continue to play hockey because it really, does have a lot of values that I think have been passed on, through the generations. And connect more and more people. And I think if we're good stewards of the sport, it can continue to do that.
Well, you were kind of hinting at this, I believe, but what I heard you say was like the National Hockey League has truly embraced the global aspect of hockey. Hockey's truly a global sport, and now there are players from all over countries, over different races, ethnicities. I think that's really one of the beauties of the sport. And in these final minutes, moments, Gam, what I want to ask you is, so what does leadership mean to you?
I think leadership is inspiration, right? It's having the sort of energy and maybe vision to inspire those around you to a common goal. I mean, I think to me that's sort of that in a nutshell. And I think it's something that can be taught, to be honest. I do think some people are get to it a little bit more naturally.
Yeah.
But I do think it's something that you can work on. And I think there's a lot of components to it. I think, being empathetic, being listening, being a good listener goes a long way. Caring. I mean, I'll just put it as simply as that. I think if you care, it's funny. Sometimes, when I think about the different aspects of my life where I feel like I've had some success, and of course that's such a relative term, but when I feel I've had success, I think it's really not that hard. It's just about really caring. Like if you care about stuff, you tend to spend more time, pay more attention, think about the details, and get other people to rally around you to actually, achieve the goals that you want. So, yeah, you put that all together, and it can be a powerful mix.
I love that response and especially that C word you use, which is caring. I've also noticed that just over the years in my own practice and all the different clinical settings I've worked in, you don't have to have the letters MD behind your name to be a leader. Whether it be a nurse, a medical student, the social worker, it's about empathy. It's about really stepping up and doing what's necessary to say care for the patient. In your world, caring for the player. But in hockey, you see leadership all the time, right? And you don't have to have the letter C, the captain, to display those leadership skills. So I love that. Well, so my last question for you, Gil, I could talk to you forever about this and about hockey and health. My last question is for you is, look, you obviously have a lot of clinical responsibilities, surgical. I know you're also in the OR, you're operating, you have a lot of responsibilities. What do you do for self-care and for fun?
Well, I wish I had a great answer for you. I mean, certainly fun. That's an easy answer. I like to be very active, so hockey's part of that. I can't play hockey too much because I don't have all the time in the world, and I don't think my body could take it.
Yeah,
But yeah, certainly try to stay active. I mean, look, the easiest thing for me to do to stay active is to do things like biking to work, right? At least I did something that day. I actually rode in college, and I remember my crew coach before I graduated. And by the way, this was at a time where I was sure I was going to do two-a-days for the rest of my life. I was like, yeah, I'm going to be 55 and doing like 14 workouts a week. Uh, it did not happen. I'm already behind on that one, but I remember he said, just do something every day.
yeah,
Doesn't have to be some massive workout. Just ride your bike. Go up a flight of stairs. Like just get a little bit out of breath every day,
yeah,
and that'll hold you over, more than if you don't. And it builds up. Like it actually does become cumulative, and it just helps you from, falling off because we've all been there. Life can be, very involved, and we sometimes just don't have time to do, formal workouts. And as far as self-care, maybe I'll answer this by saying something where I could be much better at. So, certainly with sleep, I think that's something that now we understand, for athletics, it's absolutely critical, right?
yeah,
And um, we actually have experts on the team. Our nutritionist sort of dabbles in this as well, but we have experts on the team that give the players recommendations for optimizing sleep. And that's something that I'm trying to work at and get better at, because sometimes you just the days get filled with a lot of stuff. But I think if there's something that I would impart to anybody, uh, just wanting to just optimize their health, and I know that this is a big emphasis of yours as well. I would just say, sleep is the thing we kind of short shrift the most.
yep,
And we were talking about culture, right? Culturally, we just don't care about it in the same way. Like if someone came to you and said, I just fasted, I starved myself for 3 days, you'd be like, okay, we got to intervene. This is a problem. But if you're like, yeah, I slept a few hours for 3 days, no one really blinks an eye, no pun intended. So, Yeah, we have, I
Ironic,
think as a
yeah.
society,
Isn't it ironic? Sorry to interrupt, but I mean, when you think of our profession, like when you're a med student or resident, I'm sure it was the same. Like I was never taught about self-care. If anything, you're considered kind of more macho if you say, "Oh, I only got 4 hours. I only got 3 hours of sleep." I mean, and that's so harmful. But we don't, nobody tells us that in residency. And it's ironic because that's kind of like the work that we're doing, right? Optimizing the care for other people, right? We're not sleeping enough. So it sounds like you're saying that you prioritize sleep now more than you ever did before.
I'm trying to. I'm
Yeah.
trying to, and it is very difficult because
The work
it
in
kind of
progress.
involves. Yeah, yeah, you got to say no to things, right? Like if you want to get some good sleep, you
Oh,
just have to start really refining what you do during the day.
yeah.
But I will tell you, I don't know if you feel this way, but when I am getting good sleep, I feel like the best version of myself. Probably more. I mean, look, I guess I eat okay, but look, they're all important. I know one is not more important than the other. I certainly feel it when I get good sleep. I just feel like everything is clicking a little better.
Well, I mean, there's a reason I asked about self-care, Guillem, and that's because, I mean, now, especially given my line of work, where I see people really struggling with, whether it be substance use, stress, lack of sleep is really at the core, poor nutrition, all of that matters. It matters to your brain health, how you think, how you behave. So, and now I speak to other physicians, and I just came back talking to HR professionals about self-care and how important it is. Like things that, we kind of think, oh, that's common sense, is really not that common. So like on that note, Gam, again, I can talk to you forever. We also bonded over how you and I both went to Four Nations at NHL Face-Off. You went to, I believe, Montreal.
That's
I went
right.
to Boston. So you and I clearly love hockey. It's very obvious from the answers that you gave and the career that you've had. You've had an amazing career, and you continue to do so. So, as a hockey fan, as a fellow physician and fellow Torontonian, I cannot thank you enough, Guillaume, for sharing your story with us.
Lippy, thank you so much. It really was a delight. I could also talk for hours, but I guess we got to make sure we get our Z's in tonight. So,
Right? We got to end sometime. All right, on that note,
right.
I got to drink some water. I am so grateful to Dr. Lomas for taking time out of his busy schedule to talk about his journey to becoming the team orthopedist for the New Jersey Devils. He also talked about the different musculoskeletal injuries that he sees, the concussion protocol by the New Jersey Devils, the different mental health and psychological aspects of playing at that elite level, the speed of the game. Again, if you haven't seen a hockey game live, go see one in person. It's so fast. The puck is flying like 100 miles an hour. The players are skating so fast. They're avoiding body checks. It's crazy. It's fun. Guillaume also talked about the importance of sleep, obviously to the players in order to maximize their performance, but also how important sleep is for surgeons like him, doctors like me, but also to everyone out there, including you watching. Get good sleep, get good nutrition. All of these things matter to optimize performance, not just for an elite athlete, but also for you and me. I am just really grateful for Dr. Lomas's perspective. As you can tell, he loves hockey. I love hockey. And I just hope you enjoyed the show. Please post your comments, your questions, and we'll go from there. In the meantime, here's your joke of the day, hockey themed. Why do NHL players never sweat? It's because the stadiums have lots of fans. Oh, I'm such a dork. Already, well, be sure to subscribe to my YouTube channel, write comments below, and follow me on my Instagram at Health Humor Harmony Dr. Roy. Be well, and I'll see you soon.